Hi there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this edition of Integrative Movement Insider, and this is part 5 of our 5-part series on the best exercises for working with your clients that have knee issues or Knee 101. We're sharing with you some of the basic biomechanics as well as assessments and corrective exercise strategies so that you can be successful in working with your clients that have knee problems, like my sister Sylvia, who had knee surgery, meniscus surgery, had zero rehab, and now she's got an ankle and foot issue because of no rehab after her surgery. Or my brother-in-law Wayne that twisted his knee and subluxed his patella, and now he's got knee pain and has stopped exercising and was told by his doctor, was given a cortisone injection and told to go home and rest it. And again, he's not exercising because now he's got knee discomfort and doesn't know what to do. There's so many individuals, baby boomers and seniors, just like my sister Sylvia and my brother-in-law Wayne, that need your expertise. So that's why I'm so happy you're joining me in this series and sharing this information with you so that you can pass it on and use it successfully with your clients. And again, I'm wearing my ugly sweater, which I love because it's a Seahawks sweater, for our first annual 12 days of holiday event, and today starts today's day number 2. Yesterday was day number 1 where we released our scoliosis product. So this is a resource for you if you work with clients that have scoliosis, and today will be number 2. So check out our website IIHFE for more information. Now on to this newsletter and video. So we talked about the common cause of knee issues, and that's habits. Our clients' habits, they're non-optimal and inefficient habits for posture and movement. We use the integrative movement system process, the same process we use with our own clients and patients here in our clinic, and that we teach as part of our certification courses, the Integrative Corrective Exercise Instructor Program, as well as the Integrative Movement Specialist Program. And that's first you assess, and then you address, and then you progress. In other words, you do your assessment to discover your client's non-optimal and inefficient posture and movement habits. And then you use a corrective exercise strategy to help your clients create more optimal and efficient posture and movement strategies around the lower extremity. And I've been sharing with you our 3-step process. Release the restrictions, and I demonstrated those releases, or some of those releases, in video number 3. And also in video number 4, I demonstrated a great way to lengthen the hamstrings to create more optimal anterior pelvic rotation, because your clients with knee problems need to learn how to hip hinge or rotate the pelvis over top the femoral heads. So I shared with that in video number 4. Now, the 3rd step of the process is the progress part, or the integration. You integrate the concepts from your corrective exercise strategy into the fundamental movement patterns that your clients need to do to safely and successfully accomplish their health and fitness goals. In this video, we're going to share with you one of the most common patterns we use with our clients, and that a lot of clients perform. However, too many of them are performing it incorrectly. And many of them are performing it exactly the way they've been taught by their chiropractors or physical therapists and or rehab specialists and or trainers. And that's the bridge pattern. I'm going to show you 2 different versions that we use with our clients here in our clinic very successfully, and a progression of each of them, and show you the things that we're looking for specifically to ensure that our clients have alignment and control of the thoracolpelvic cylinder, maintain alignment of the hip, knee, ankle, and foot complex, and use their glutes appropriately and not actually cause the problems that they're trying to solve using the bridge pattern. With the floor bridge pattern, place the feet about hip width apart on top of a stack of steps. Align the head and neck and thoracolpelvic cylinder, maintain that cylinder alignment throughout the pattern. Lift up, maintaining alignment of the trunk, spine, pelvis, and hip complex. The weight should go down towards the feet, and then hinge at the hips, maintaining alignment. And the first thing that should hit the floor is the backside of the pelvis or glutes. Lift up without over squeezing and going into that posterior pelvic tilted position. Stay more neutral, bringing the weight down towards the feet, and then hinge to come back down. As soon as you touch, come right back up. The head should not move back that direction. The shoulders should stay open and wide throughout the pattern. The progression is to start again in the same alignment. Head, thoracolpelvic cylinder aligned, feet hip width apart, lift up, lift one leg up, maintain alignment of the thoracolpelvic cylinder, come back down. So this is the marching bridge version with no rotation, no change in the pelvis position or lumbar spine position as each leg is brought up off the step. So again, you should not be able to tell that the client is moving, except for the fact their hip is flexing and their foot is moving off the step. The TPC stays entirely still and quiet throughout the pattern. With the bridge pattern on the bench, align the thoracolpelvic cylinder, so oftentimes you'll have to have your clients sit upon a block and or foam pad so they can maintain more optimal neutral alignment. Feet, again, are hip width apart. Hip, knees, ankles, and feet are in alignment. Place the hands behind the head, make sure the bench does not slip, and then lift up so the body is in a straight line. The weight is down towards the feet, not back towards the head and shoulders. Maintain this alignment and then hinge the hips until the pelvis comes back down and touches the floor, and then come back up towards the ceiling. Do not overextend and bring the pelvis into posterior pelvic tilt and lumbar spine flexion. So keep the pelvis more neutral, keep the weight down that direction. Hinge and then come up. The progression from this pattern is now bring the feet closer in, maintain this alignment, lift one leg up, and now just perform the bridge pattern with single leg. Again, there should be no rotation of the trunk, spine, pelvis, and or hip complex throughout the pattern. Switch legs, maintain alignment. There should be no shifting as the next leg is brought up. Hinge, maintaining alignment of the thoracolpelvic cylinder. So flexing as the pelvis is brought down to the floor or pad, and then lifting, using the glutes to lift up, but not going into hyperextension of the hip complex, which is putting the pelvis into posterior pelvic tilt and lumbar spine flexion. If you enjoyed this video and it helped explain exactly how to set up the bridge pattern and why we set the bridge pattern up the way we do in the integrative movement system. Our goal is to help our clients align that thoracolpelvic cylinder and to move or hinge specifically around the hip complex, and to maintain alignment of the hip, knee, ankle, and foot, as well as the pelvis as the individual moves into their single leg version of the pattern. Great way to teach your client how to use their glutes, how to maintain alignment and control of the lower extremity, how to use their core appropriately, and safely and effectively progress your client while reducing stress upon their knees so they can do the things they need to, want to, and oftentimes return to those things they love to do. This is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Don't forget to watch our 12-day end-of-year holiday special for some of our most popular products to help you be that specialist that your clients, your current clients need and want, and your potential clients will seek out. Thanks so much for watching. We'll catch you next time at Integrative Movement Insider.